All right, so you're back with us in See the Stories on the 3-hour news show on City, and we're still here with Felicia talking about ABA therapy for children with autism. So tell us more about the outcome of an ABA therapy, Feli.
So a good outcome, number one, the child needs to be happy. I think that's number one. And then number two, parents and families as well as teacher needs to see notable differences at home as well. The child needs to be more independent, say, in requesting and refusing something politely, and also being able to contribute to their community meaningfully. Like, for example, in my school, I have a minimally speaking child, but he's able to use a communication device to choose a song to be sung at circle time for everybody. I have an inclusive school, and so we need to be very cognizant in making sure that we are giving the same chance. Well, we need to be able to support children who with autism as well, giving them an opportunity to contribute, such as choosing a song.
Yeah. Okay.
Yep.
So ABA is widely known for treating autism, but we want to know, can they help children with other conditions as well? The same method, the same therapy?
Yeah, really good question. So again, there is this misconception that ABA is only used for children with autism and their therapy. However, since it is a science, it has far-reaching application beyond just autism therapy. I also use ABA to help children with ADHD, Down syndrome, and my grandmother. She's 88 and she has dementia, and I use ABA to help her.
All right.
Yep. And classroom management for sure. Yeah, it has far-reaching applications.
I think for a person like me that is so green about autism, and I believe many of Indonesians are still green, not really aware and understand about what autism is. So what should the public do in more understanding children living with autism?
So I think number one, be welcoming. You know, like if you see a child with autism entering, say, a religious space, right, and the child is stimming, maybe she or he is screaming or maybe flapping their arms or running back and forth, and maybe the parents feel sort of mortified by it, we can say, oh, don't worry about it, I understand, that doesn't bother me at all.
Right,
you know, things like that create a more welcoming atmosphere. And then also we need to be careful of like loudspeakers, you know, sometimes because kids with autism, a large percentage of them has sensory processing disorder as well. And if you notice a child going like that, it may look impolite, and this is what I see a lot of people do. They try to pry the child's hand open, but it's hurting their ears, you know? And so if you see something like that, maybe we can ask the audio person to turn down the volume. Whatever it is that the child feel a little bit uncomfortable, maybe we can make some changes to make sure that they're feeling more comfortable.
Right.
I have a question. If kids, I've seen a lot of, not a lot, but a few kids that likes fans or anything that is turning, like the laundry machine. Is that one of the symptoms of autism?
Yeah, so repetitive behavior, I think that is the technical term for it. Yes, and I think connecting to your previous question, it's also important for us to accept that it's okay for them to look at, you know, turning fans, for example. It's not hurting anybody, right? It just looks unusual, but maybe we need to create a new norm where that is okay as well. Yep.
All right, so Ibu Feli, just so you know, we like to play games here.
I like to call her Kakak Feli.
Kakak Feli, even better, that's right. So it's our tradition to wrap up See the Stories talk show with a game. And our fellow host Kai will lead today's game, so come on in.
Hello. You know what? I've been like, whatever Kak Feli said before, I was like, yes. So I'm a neurodivergent diagnosed at 33 years old. I have ADHD, so she was like, yes, I have severe sensory processing disorders, and it's getting a lot worse by age. So she was like, yes, create a new norm. So I want to know and test you as a neurodivergent friend. how much you've learned through this conversation, and hopefully be able to be more conclusive with the people, new people you meet.
Right, right.
It's actually, we're not that hard to identify, right?
No, I think I have ADHD.
I'll try my best. This is the new thing for me. I'll try my best.
Yes. So we'll be playing a game called True or Lie. So I'll show some statements about ABA therapy on the big screen. Yanni and Rory must guess whether these statements are true or is a lie. And Felicia here will then give the right answer and a brief explanation about each statement. So are we ready?
Yes,
Ready!
All
we
right.
are.
I am looking forward to see. True or lie, ABA therapy can be harmful or abusive.
Of course.
Lie. Of course, no.
Lie. Well,
Does it depend on the therapist?
Yes.
It depends on the therapist.
Bonus point.
Okay, so it might be true.
Yes, absolutely.
okay.
It's not harm.
No, it's
No,
not
no, no, no,
okay.
no.
Wait, so, but, hold on. Okay,
Should I give
explain.
my answer now?
Yeah,
Please.
All right. So
That's
absolutely,
nice.
that's why ABA practitioners need to be very, very careful in conducting their therapy, right?
Oh, okay.
They need to keep up with the most current research to make sure that they are not doing any harm to their clients. For example, we nowadays we are getting more and more cognizant of client consent. And we are working with a lot of clients who has very limited communication, and so they won't be able to tell you, I don't like that touch, you know, or I do not want to continue therapy anymore, right? And so we have to make sure we pay attention to their body language. If I see that a client of mine or my student is tensing up when I'm about to physically prompt the child, then I need to say, oh, it doesn't look like you want me to touch you. Okay, then I will switch to a different type of prompting.
Right, right.
That's number one. And then number two, we need to really reduce the use of restrictive practices. That means, you know, giving the child a bear hug, you know, from behind in the name of not hurting him. We have to make sure that we keep those to the very, 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 very minimum and use them when it's absolutely necessary, when the child has become extremely aggressive and trying to hurt people, right?
Yeah.
There are many ways that we can use to prevent that challenging behaviors from happening. For example, that the consent, paying attention to child's consent. If that person tensing up their body and I keep on touching them, guess what will happen? Right? The child will probably throw a meltdown. I really hate what you're doing right now. So we can definitely prevent it. And then if there is challenging behavior, we can teach alternative behavior so they can get the same outcome with a different behavior. And we definitely have to reinforce that behavior. So for the ABA practitioners out there or any teachers who are working with children with limited communication skills, please be careful.
Right.
all right. So note taken. Second answer. So wait, was it a true or lie?
Depends.
It depends. So it's,
Okay.
Yep.
Therapist, right?
So it's 50-50. Okay, next question. ABA therapy doesn't work for teens.
I believe it's a lie.
It's a lie.
It's a lie, I believe so,
because
right?
you told a story about even
Yeah.
elderly with dementia.
Yeah, yeah. It also depends on the age group, right? ABA can be used for people living with autism at different age groups. Is that
yes,
right?
autism at different age group and also across different disabilities.
Okay. Okay. Down syndrome and.
Yep.
All right.
Okay, so both of you got points for this one. Next one. ABA therapy cannot cure autism.
Oh, we didn't ask her.
Cannot cure autism.
Now this is really interesting.
Cannot
I don't
cure
think
autism.
autism
I think
can
it's
be
true because autism cannot be cured, but it can be minimized.
I don't know. What do you think?
I don't know.
Come on, yeah, just guess.
I'm gonna say lie.
I'm
Okay?
gonna say
so,
true.
So it'll be
Okay.
different.
All right, you are right.
Hey!
Yay!
Yep.
So what's the explanation?
Yeah, because autism is not an illness. It's
okay.
like
Okay.
it cannot be cured
Yes.
from our ADHD, right?
We cannot get a brain transplant.
There you go. There you go. But we can learn skills,
Right,
and
okay.
which is
Right.
what we do with ABA therapy. We're teaching the kids skills so that they can function meaningfully in the community.
I I think what you mentioned is really, really important because recently there's been a lot of people using the term mental illness a lot and associating neurodiversity with mental illness, which is something completely different because mental illness is something that happened while you were born with your neurodiversity, right?
Correct. Right? Yep. Excellent. 100%. Yep.
There you go.
Very
Educate
good.
yourself. Last question.
Last one. Okay.
ABA therapy only focuses on behavior management instead of academic skills. Oh, are they mutually exclusive?
It is a lie.
I'm so unsure because we do not talk about academic skills, right?
Because it addresses how children with autism can fit into the society and professional work. I don't know.
I'm gonna go say a lie. Just because I'm unsure, because I don't think I asked her anything about academic skills. Did we ask? No, we didn't.
No, but she mentioned about a person working for WHO or UN or something, UNESCO or something. Yeah.
Okay.
100%.
100%. Eli, right?
Yep.
Yay!
Yep. So actually, again, ABA is not just for children with autism, right? There is a branch of ABA called precision teaching, and it is teaching academic skills to children who with disability or without disability. In the States, it's been used to teach children from lower SES, social economic status, who also tend to perform lower in standardized tests, and it's shown to be very effective teaching reading, teaching math. So absolutely,
especially kids with ADHD who struggle so much with studying.
Oh, yep, absolutely.
Well, Felicia, thank you so much for coming and giving us a very nice update on how to be more inclusive, and I appreciate this so my friends can
we can understand Kai better.
We're trying hard to.
Thank you.
No, but there's not just me out there, and there's a lot of people that we meet every single day that might have that you might not notice on first glance.
Yep.
That they are neurodivergent.
All right. So thank you so much for being here. Please come back next time.
Yes. Thank you for having me.
All right. See, the stories will continue after the break. Stay with us only on the 3 Hour News Show on See Today.